welcome to Nurse TCM. Today we'll discuss the chronic kidney disease. The chronic kidney disease is very common in nephrology. Let's take a look. A 50-year-old male suffers the chronic kidney disease stage 4, hypertension, diabetes, and hyperkalemia. This patient suffered fatigue 2 years ago and visited a local doctor and diagnosed as the chronic kidney disease. His serum creatinine was elevated more than 2 years. Now let's take a look at present symptom. Proteinuria 2+, dark black complexion. His blood pressure is under control after taking the ARB for hypertension. He suffered hyperkalemia, so he taken some Western medicine which caused a loose stool, dizziness, defecation 2 to 3 times per day. That is also for Western medicine. Night urination once per night, neck pain, decreased creatinine after herbs, so it means the treatment to him is very effective, so creatinine is decreased. Red tone body with a thin tone coating, thin wiry pulse. Let's come to the pathogenesis of the disease. Generally speaking, the chronic kidney disease is corresponding with the kidney and spleen deficiency. The kidney deficiency includes a qi, yang, and a yin. There is no absolute in which stage which one suffers more, because it's corresponding with 2 aspects. One is the patient's body constitution, so its basic constitution, which will change and lead the development of the disease. On the other side is corresponding with the development of the disease, severity of the disease, so sometimes maybe it's a qi or yang or yin. But no matter which one, in the final stage will impact to each other. For example, it's a yin deficiency, but if for a long time, yin deficient impact to yang, yang cannot be grown by the supporting of a yin, so yang deficient at the same time. So this is a mutual supporting and also mutual restricting. Kidney and spleen deficiency will form the obstruction in lower jiao, or we say full organ, especially large intestine, small intestine. That is because this lower jiao is a space. It's not 1 or 2 organs. It's composed of the multiple functions from different organs in one space, and they have to cooperate with each other very well. If the kidney spleen deficient cannot promote and give enough energy to promote the qi moving, so there is a stagnation in food organ, which impacts water metabolism. On one side, we know the basic physiological function of the small intestine in TCM is to separate the clear and the turbid. The clear refers to the very useful nutrients which should be absorbed by body. The turbid refers to some waste should be discharged from urine. And large intestine also same. Large intestine is very significant pathway to discharge the waste of the body. So if there's a qi stagnation and the weakness of the qi, which is lack of the power to discharging the waste, there's a retention of such kind of waste and toxin in large intestine as well. And meanwhile, this kind of stagnation is very easy to generate blood stagnation, because this kind of qi stagnation very easy to damage blood collateral of the organs, so generate blood stagnation in masses. At the same time, liver qi stagnation is very important as well, but different from the cardiovascular disease. And we know in cardiovascular disease also maybe is corresponding with excessive liver qi attacking the upper, but here if the excessive liver qi is prevented by damp heat or dampness in middle jiao, because here kidney and spleen is very weak, sometimes yang or qi deficient, so this makes the situation worse in retention of the water. So different from the hyperactive qi moving freely in cardiovascular disease, no much retention of water, no much block in the middle jiao. In this situation, in chronic kidney disease, liver qi seems prevented by damp heat, and which will make the dampness retention worse. And another very important thing that we have to mention is the small intestine. We have mentioned the basic function of a small intestine is to separate the clear and turbid. And in the urine testing, we say most patients suffer proteinuria or lipiduria in chronic kidney disease, and such kind of loss of useful things of the body, we say the small intestine cannot or lose the normal function to separate clear and turbid. So it means even if it's clear what we need, the small intestine cannot reserve it for body but discharge to the urine. So when we tested the urine, we found a proteinuria or lipiduria, we believe it's kind of a dysfunction of a small intestine in separating clear and turbid. And also in the chronic kidney disease, very important things is large intestine. Large intestine plays a very important role to discharge and detoxification in lower jiao. Because no matter the toxin or immune complexes which are located in the kidney, it should be discharged outside the body by urine or by defecation or by stool. So the damp heat discharging on one side is by urine, on the other side is by stool. So large intestine plays a very important role in the treatment of a detoxification and also dampness. Take a look at formula. Doctors use a series of herbs to tonify kidney qi and tonify spleen qi. We have mentioned in the pathogenesis, kidney and spleen qi plays a very important role in water metabolism to prevent water retention. But if it's deficiency of the qi in both of the kidney and spleen, the retention of water seems to be easier. So tonify the qi in kidney and spleen is to treat the root. And also doctors use something like 黄鼠葵花. This is especially for proteinuria. It's more like an immune complex inhibitor or like a proteinuria inhibitor. This is according to modern research we found this kind of medicine especially very useful in treating the proteinuria and immune complex inhibitor. And also doctors select the 蒲黄 and 五灵脂, which is called 失效散, to activate blood and relieve pain and also remove the blood stasis. This is because we have mentioned by the obstruction of the Fu organ, it's easy to damage the blood collateral and form the blood stagnation. So in the microcirculation of the kidney, which was blocked by the blood stagnation and blood stasis as well. So in the selecting of the herbs, we also have to select the formula 失效散 to activate blood. And also we have to use one herb, 夏枯草, to soften the masses. This is a combination of activating blood. And 熟大黄. 大黄 is really important herb used in nephrology. So it will break the blockage in large intestine, promote defecation. So we have mentioned in pathogenesis a lot. And in this formula, doctors use a lot of things to clear away turbid urine in urinary bladder. So from the formula, we can believe that the 标, that means the retention of the urine seems very serious in this case. So when we treat the patient, we have to select a lot of herbs. We use a lot of herbs, different species to treat the retention of the urine, retention of the turbid water in urinary bladder by promoting urination. And also we have to combine with treating the bone, the root, kidney and spleen, tonifying the kidney qi and spleen qi. Thanks to the patient to provide the information for us, and also thanks to Jiangsu Provincial TCM Hospital. Thanks for watching. See you next time. Bye.